I am Dr. Santanu, Naskar, consultant gynecologist. Today our topic of discussion is preterm birth. Preterm birth is defined as birth before 37 weeks of gestation. It is fairly common, having an incidence around 10 to 15% in India, which is quite high in India within the global population. It is very common in patients, particularly with twin pregnancy or multiple gestation, or patients with polyhydramnios. That means increased liquor within the gestational sac, and associated with bleeding in early pregnancy, and also the patients with diabetes, hypertension, having addiction like smoking, and also patients who are suffering from depression. And it is also common in patients who conceive very early, and also patients who conceive in later part of 30s, like 36, 37, 38 years of age. Patients with preterm labor or preterm birth most commonly presents with complaints of sudden onset pain in lower abdomen, and it may be associated with dribbling or bleeding. Patients should report immediately to us whenever these symptoms like this type of pain or dribbling or bleeding, whenever it happens, they should report to us as early as possible. Initial assessment should be done that whether we can continue this pregnancy or not, depending on the length of the cervix, whether the sac is bulging to the cervix or not, depending on which we prescribe tocolytic agents. If tocolytic agent is not possible to be given to these patients, then the patients usually shifted to a better setup with proper NICU facility so that these babies can be managed. Because preterm labor, the babies are usually small with low birth weight, and sometimes they may also suffer from prematurity. Sometimes it also prefer to give steroids like cortisone injections so that their lung maturity is enhanced, so that the breathing problem and other complications of the preterm delivery that is minimized. And lastly, but not the least, that the patients who gives birth to these premature babies, these babies may later on go into cerebral palsy and vision problem, delayed development, all this type of problems. So patients, please mention us the early symptoms as I mentioned, like pain in lower abdomen and any form of dribbling in early part of pregnancy, especially around 5 or 6 months. Please give early response. Please come to us early so that we can take necessary measures to minimize the complications of preterm birth and delivery. Thank you.